Good evening and thanks for joining us. Tighter public health restrictions are coming to millions of Canadians as COVID-19 cases keep rising in parts of the country. In Quebec, 3 hotspot regions, including Montreal and Quebec City, are now on red alert. That's the highest level in Quebec's COVID-19 alert system.
The situation has become critical. The number of cases is rising. If we don't want our hospitals to be submerged, if we want to limit the number of deaths, we must act strongly right now.
Starting on Thursday, the 3 regions will be partially locked down for 28 days. Schools will stay open, but gathering places like casinos, libraries, bars, and restaurants will be closed. Only takeout will be allowed. As well, people are not allowed to have guests in their own homes, apart from a few exceptions. Here's why. Quebec has the most new cases reported in Canada today, 750. In Manitoba, where 39 new cases were reported today, new code orange restrictions are now in place for the Winnipeg area. That means mandatory masks in most indoor public spaces and a 10-person limit on gatherings indoors and outdoors. And in Ontario, 700 new cases were reported today. That is the most in a single day since the pandemic began. We will get to Ontario in just a moment, but first to Quebec, where Premier Legault held a news conference late this afternoon to explain that red alert and the new restrictions. Global's Felicia Parrilo is in Montreal. Felicia.
Well, Donna, late today, the Premier announced that for regions in red zones, the visits to other people's homes have been banned, as well as bars, casinos, movie theaters, and restaurant dining rooms. Masks will also be mandatory in outdoor situations where 2 meters isn't possible, including protests. Now, as you can imagine, this type of confinement is bringing up some anxiety for some people.
The dining room at Jukebox Burgers is quiet. Customers are few and far between, which has been the case since reopening back in June. The owner says another shutdown would be devastating.
Being an operator, I can adjust employees, payroll, purchasing, but I can't the rent. And good luck now going back to the landlord and saying, hey, there's going to be a lockdown for 28 days and can I reduce rent? They're going to, blow you away. Montrealers
are anxious to know how the new restrictions will affect them.
I manage sports installations, arenas. So when you tell me that, basically I'm thinking, hey, tomorrow we might be shutting down.
As for schools, though there have been outbreaks, provincial officials have said they would remain open even if a region moves to red.
It's an essential service. We can't go to work and do the family at the same time.
While hospitalizations and deaths across the province remain much lower than during the first wave, experts warn that those numbers could increase in the coming weeks.
As the number of cases goes up and as more and more people get infected, and if you start seeing outbreaks in the long-term care facilities, as we're starting to see now, that could change very, very quickly.
Dr. Christopher Labo says the good news is that we can curb the spread of a second wave if people limit their social interactions and stay home.
Now, I want to underline that most businesses in red zones are staying open, as are the schools. The Premier has said he hopes these measures will only last 4 weeks, but he says he won't make any promises. Donna?
All right. Felicia Parrilo in Montreal. Thanks. Here's the number political leaders and public health experts are watching closely. With infections surging, the number of COVID-19 patients in hospitals in multiple provinces is starting to go up. In the last week in Ontario, the number of COVID-19 patients who ended up in the hospital nearly doubled from 65 to 128. The Ontario Hospital Association says drastic action is needed now. It wants parts of Ontario, the Toronto region, and Ottawa to return to stage 2. That would mean a ban on indoor dining and drinking at bars and restrictions on other non-essential businesses. As Eric Sorensen reports, that's not happening yet.
Barely a week after the Ontario government restricted the size of gatherings to no more than 25 outdoors, hundreds of people gathered in Wasaga Beach for a weekend car meet that included street stunts. Charges have been laid, but this may be just an extreme example of a failure to physically distance in a province with a mushrooming increase in COVID-19 cases. Monday's confirmed case numbers, 700, is the highest daily spike since the first wave of the pandemic last spring. And the recent trend shows a second wave is here. Plus, the Ontario Modelling Collaborative predicts the province will surpass 1,000 cases a day by mid-October. Ontario's premier says the second wave could be worse than the first.
We know that this wave will be more complicated, more complex, but what we don't know yet is how bad the second wave will be. The reality is, it's up to each of us.
End of summer socializing may be partly to blame. Young people account for most of the recent confirmed cases. But the percentage is falling for those under 40, suggesting cases among older and vulnerable populations are rising.
People have gotten very casual, I think, at the end of summer, early fall, and we've seen that effect.
Indeed, hospitalizations in Ontario have almost doubled in the past week.
But the most alarming feature is the fact that now we're seeing an increase in hospitalization usage. And with the increase in hospitalization usage comes ICU usage, comes ventilator usage, and eventually deaths.
The province says it'll spend $52 million to hire and train more nurses and personal support workers. But the Ontario Hospital Association also wants restrictions in and around Toronto and Ottawa to target bars and restaurants and gyms, theaters, and church gatherings. The province wants desperately not to shut down the economy again.
We don't want to turn back a stage unless we absolutely have to, but if we do have to, we will, because the most important thing is the health and well-being of the people of Ontario.
A second wave of COVID-19 was expected in the fall, but experts are surprised at the speed with which it's apparently arrived. Eric Sorensen, Global News, Toronto.
Toronto's top doctor is putting a pin in the idea of social bubbles. Dr. Eileen de Villa says people should avoid meeting anyone outside their immediate household.
There's an immediate rising risk in Toronto of continued and significant COVID-19 resurgence. What we need you to do is to think carefully about how to protect yourself as you go about your daily activities.